Sounds good. So, good morning, Red Carpet. Like we always say, it's always a good day when it's a red carpet day. I'm sure you're sick of me saying that every time, but it's the truth. Like Kim said, quick reminder, any questions, please put them in the chat. We want to make sure that if questions do come up, we do answer all of them. So kind of keep that going in the chat. So this morning, we do have the pleasure of welcoming Jason not only to the chamber, but to Fort Collins. So welcome, Jason. And I have the pleasure of introducing Jason. So Jason actually came here from Florida. He was born in Naples, but lived in Orlando for most of his life. He's always kind of had a love for the state of Colorado, and who can blame him? And he decided he needed to change his scenery, so he made his way here. He did quite a bit of research. He is in the medical field, so he's good at research. And he researched and he found his way to wonderful Fort Collins. So obviously there's some good info out there about us. So like that. Jason's family is pretty kind of scattered all over the United States. He's got family living in California, Florida, Texas, Maine, but most of his immediate family is all back in Florida. His mom is a pilot. His dad owns his own business. His brother just had a baby, and his sister's stuck in Canada. I think we all know why. I think she made her way to Canada to visit her boyfriend's parents. This weird pandemic hit and she can't come home. So I'm sure she's having a good time in Canada. That's not a bad place to be either. Jason found interest in medicine after he had a few surgeries back in college. He switched his area of studies from aerospace engineering to medicine. So we're dealing with a pretty smart cookie here. However, after he spent some time working in traditional medicine, he kind of started to see the pitfalls of that traditional system. He didn't want to get burned out. Like many of you know, a lot of healthcare professionals do get burned out, especially in that traditional system. And so he decided, you know, I'm going to go ahead and start my own practice. I'm going to start it my own way. I'm going to kind of do this new concept. And here we are, and we're going to learn all about that today. Jason is a big outdoors guy, so good way he found his way to beautiful Colorado. Jason loves to scuba dive. He happens to be a rescue diver, so if you're going to go swimming on Horsetooth, make sure you bring Jason. He loves backpacking. He did spend about 4 months backpacking through Costa Rica, Belize, and Guatemala. And it sounds like he's a lover of a good hammock. So he likes to kind of spend time in his hammock. So who can blame him there? What is something that not a lot of people know about Jason, but you really should. Jason kind of jokingly responded with me. He said, "Mornings are for sleeping. Please stop calling me in the mornings." I think many of us can relate to that. So I'm glad I know it's the morning now, so I'm glad to see all your faces on this call. If Jason had to lose one of his senses, it would be smell. He said that would be the one that least impacts his life. I mean, he's an MD, so I'm going to take his word for it. He knows more about that than I do. So thank you, Jason. We're excited to have you, and let's give Jason a warm red carpet welcome.
Hi, everybody. So first off, not an MD, I'm a PA. I gotta clarify that point before we get started. So I'm putting a little thing in the chat here. So if you guys get a chance, please put your name, email, all of that. I do have some newsletter that'll be going out pretty soon, and if you'd like to be a part of that, please put your email. And let me switch over, start sharing my screen, and we will get this started. Okay, so to get this started, I am Jason Rogers. I am the president of Starlight Health, and we are a direct primary care in Fort Collins. What I'd like to do is kind of set the agenda for you today. I'm going to go a little bit over who I am, what the traditional healthcare system is like, some of the pitfalls with it, and then I'm going to get started and actually talk to you about what direct primary care is, how it works, and how it can improve your health and save you money. All right, so who am I? Like Chad said, I'm from Florida, born in Naples, lived in Orlando for most of my life. I lived in Orlando from about 4th grade all the way through college. I actually went to the University of Central Florida for engineering and decided to switch to medicine in about my 3rd or 4th year. So if you've ever had the great idea to, go to college for 7 years, that's a great way to do it. And yeah, so I switched that. I went to EMT school, so I became a medic, and I worked on an ambulance for about 2 years. before deciding to go to PA school. And after PA school, I decided I wanted to travel as much as I could. I wanted to experience as many different patient populations, as many different specialties as I could. So I traveled all over the country. I did pediatrics, I did family medicine, I did urgent care, I did rotations in surgery, I did orthopedics and plastics and general surgery and all kinds of different specialties. Until eventually I decided to switch over to direct primary care and start my own thing. Now, before I get into telling you about direct primary care, I want to talk to you about the reality of traditional medicine that most people are not aware of. Let me switch something really fast. So the traditional system works on a concept known as fee for service. So the fee for service model is exactly what it sounds like. When patients come in, they are charged for the services that are provided. And if you don't go to the doctor's office, you don't have to pay anything. But when you do go to the doctor's office, you are charged and typically charged a significant amount for these services. So there's a lot of pitfalls that comes because of this. And the first one I want to talk to you about is healthcare avoidance. So many patients, because of the fee-for-service model, will wind up not going to the doctor's office when they are sick, or when they are well, and will only go when they are sick. And many patients will avoid these symptoms in their beginning stages, when they are just starting out, because they don't want to pay the major costs associated with it. And arguably, the best time, the most important time to go to a healthcare provider is when you are well, so that we can talk about preventative strategies, to talk about maintenance of health. But instead, many patients will wait until they're sick, and not just sick, but very, very sick. I have lost count how many patients avoided going to their healthcare provider for 4 or 5 years and come in with stage 4 cancer where it's inoperable and untreatable. And on the contrary, I have also lost count on how many times I've caught things early because they came in often and they came in quickly, and we were to catch it in the early stages. So the next thing I want to talk to you is about markup. Now, because we work on a system known as a fee-for-service in the traditional system, built into the pricing structure is not just the cost of supplies, but also the cost of the doctor's salaries, the nurse's salaries, the overhead for the practice, the electric bill, the water bills. All of that stuff is built into the pricing structures of everything we do. And what happens is, at the end of the day, the healthcare practices have to figure out how many patients do they need to see in a day, how many procedures do they need to see in a day, and at the end of the day, they figure out how many they need. And that runs into the third problem here. So down here is the actual billing codes that we use in a traditional healthcare system. So for example, if you were to spend 10 or 15 minutes with a patient, I would charge you $90 for this. If I saw you for 20 to 25, there's 130, 30, 45, 180. And how this plays out is, if I were to spend, for example, 60 minutes with a patient, so I saw one patient in an hour, and I sat down and talked to the patient, I got to know them, I went in depth, in detail, learned their history, learned their families, all of that, did the best possible medicine I could do, I could be able to charge $180 for the service. On the contrary, if I were to cut down the visit to, say, 10 minutes, and I were to see 6 patients in an hour, I could make $540. And again, this is not just $180 that goes straight to your provider. It also includes the overhead expenses, the salaries for the nurses and the staff and all of that. So at the end of the day, most practices, providers need to see between 25 to 30 patients in a day in order to cover all of their expenses. And that scales out to most practitioners requiring between 2,000 to 3,000 patients on their panel. At my last job, when I was in the traditional healthcare system, I was personally responsible for 2,500 patients. And if you have ever tried to remember the complex history of that many patients, it is impossible. Don't try. So because of that, I mean, it's impossible to keep up. There's this forced volume because of how this billing structure is and how there is diminishing returns based on how much time you spend with the patient and how many you see in an hour. And it's just impossible to keep up with. And that leads me into what is direct primary care. And direct primary care is basically stepping out of the system. And what happens is the providers, such as myself, will contract directly with our patients and bypass the insurance system altogether. But that's not to say that we can't accept a patient who has insurance. On the contrary, we can accept a patient that has almost any insurance. We just don't bill the insurance. So the difference here is we treat health insurance like one would treat homeowners insurance or renter's insurance. The average person would use homeowners insurance in the cases of a catastrophic problem. So a fire, a flood, a tornado, a hurricane, some kind of major damage like that. That's what health insurance, or that's what homeowners insurance is for. But you wouldn't use homeowners insurance to paint the walls, to fix the light bulb, or to fix the garbage disposal. That's not what homeowners insurance is for, and that's not what, in direct primary care, what we use health insurance for either. So my system works under a membership method. So instead of the fee-for-service model, where each and everything you do includes the overhead markups, which are astronomically higher than the actual supplies that are utilized for any procedures that we do, we pull all of that out and we fix it to one monthly fee. So no matter how many services I do, it doesn't matter how many times I see a patient, it doesn't matter how much blood work, how many labs, how many services, my income and my profit is fixed to one monthly fee. So what this does is it stabilizes the healthcare expenses for patients, and the services that I provide are offered at the cost of supplies or near cost of supplies, not the marked up costs. And this reduces the likelihood of catastrophic costs and catastrophic events. So for providers, what this allows us to do is to stabilize our income without requiring an increased volume or a quota of patients for each day. So with a less volume, and here from the fee-for-service model, going from 2,000 to 3,000 patients, a direct primary care can have between 200 and say 500 patients. So this allows us to have more time with our patients. It allows us to have greater access. I can see you same day. I can see you in the next day. I can follow up with you. I can research your case. I can go to your house. It doesn't have to be complicated. I don't charge you every time you call. I don't charge you when you come in. This is what the membership model allows us to do. So now I want to talk to you about the actual numbers, the nuts and bolts of how this system works. Like I said, the markup, the overhead, the staff salaries, the profits is all fixed to one monthly fee. For seniors, I charge $100 a month. Adults is $85 a month. Children is $50 a month. I don't see children on their own. I see them in combination with adults, so they're as a family. I also offer the system as a benefit to employees. So if you are looking to offer this, if you're an employer and you're looking to give this as a benefit and all of that, this is a great system to help you guys save money. Built in to the membership program, you get unlimited visits. You can be seen as many times as you want. I do telemedicine. You can call me, you can text me, you can video chat me, we can email, all included, no extra charges for that. I do house calls, so I don't have an office. Instead, I will actually go to patients' houses, and I can spend up to 90 minutes. It depends on the schedule, but 30, 60, 90 minutes, not a problem. That's what is offered. Now, this is what I'm talking about when I mean near cost of goods and services. So these are two examples. They were picked at random. These were not exceptions to make a great PowerPoint presentation. I picked them at random. So this is steroid injection. The actual cost of supplies in order for me to offer this service, between the gloves, the alcohol, Band-Aid, syringe, medication, it's a grand total of $9.58. My practice would charge you $10 for this service. On the contrary, if I were to see you in a traditional healthcare system, or if you were to see a different provider in the healthcare system, to bill this towards your insurance, to apply this towards your deductible, you would pay $130 for the visit. You would pay $100 for the injection. You'd pay another $90 for the follow-up visit. You would pay a grand total of $310 for a service that costs $9.58 in supplies. This is a retail markup of 3,236% above the cost of supplies. The same thing happens with blood work. The actual cost of supplies to provide these tests, so the actual cost to me to provide this to patients for a routine blood panel, CBC, CMP, lipid, thyroid, urinalysis, routine stuff that I do on every adult patient that walks through the door, grand total of $14. I would charge you $16 for this service. But in a traditional healthcare system, if I were to apply this towards your deductible and bill your insurance for this, everything has this markup. The overhead, staff salaries, the profits, the malpractice, all of that is included in each and every service. So you get a markup here for this one, markup, markup, markup. Then you have the doctor's visit just to get the order. You have the follow-up visit to get the results. You would pay $401 for blood work that cost $14 to provide. That's a markup of 2,864% above the cost of supplies. So this is what happens in the traditional system versus a direct primary care. And I want to play this out with an annual cost analysis. So an individual adult, low premium, high deductible plan, let's say they have an $8,000 deductible. This is what my insurance plan is. I have an $8,000 deductible, so this is me. The DPC membership, the baseline cost is $85 a month times 12 months. That's $1,020 for the year. I do not charge for the visits, as long as you are within about a 15-minute radius of me and I can drive to you in a short amount of time. I don't charge for that. If you're really far away, I might charge a little bit extra just for gas and all that. But all of this is provided at near cost. So these are the actual cost of supplies. So $35 for sutures, $450 for an MRI, X-ray 60, blood work, flu test, strep test. This patient went from baseline of $1,020 for the year to $1,600 at the end of the year. And that here on this graph is the blue line. That's right here. It goes right across. It's a flat line for the year. And this is what I call DPC stabilization, or stabilization of expenses. On the contrary, if this same patient were to receive the same care, so seen the same number of times, received all the same services, and I applied it towards your deductible and I billed your insurance for it, you would go from 0 at baseline, that's this gray line, all the way up to $4,205 at the end of the year. So this patient here, even though it applied toward their deductible, paid out the equivalent of 1, 2, 3 years of a direct primary care membership. And let's say, for example, they were seen less times. So again, had the same procedures and lab tests done, but was only seen twice in the year. So instead of once a month, they were seen once every 6 months, maybe twice a year. They still would have gone from 0 at baseline all the way up to $2,405 here, which again is almost $1,000 above the direct primary care membership. So this kind of explains, it's been a little bit of a top level overview of what direct primary care is, how it works, what it does. Usually at this point, we would do a little bit of a drawing, but in this particular instance, I'm less interested in giving you the chance to win a membership, and I'd like to offer you the choice. So I do have a red carpet special offer for anyone who is interested. If you choose to schedule a consultation appointment with me within the next 3 weeks, so this is an expiration date of August 28th, you will receive 3 months of free membership fees when you officially sign for both you and your family. If you are among the first 3 patients to choose to officially sign with us, you will receive an additional 3 months of free membership for both you and your family. So that's, if you're the first 3 patients, you can get up to 6 months of free membership. This offer expires on 8/28 on the dot. There are some eligibility restrictions. You cannot have Medicare, Medicaid, TRICARE, or any other federally funded insurance program. It is illegal. I cannot accept you. But if you have no insurance, if you have a non-federal insurance like Cigna, Blue Cross Blue Shield, Aetna, any of those private insurances, not a problem. Health share is not a problem. Your family and your friends are welcome. You must be over the age of 4. This is your chance. This is a one-time offer to experience direct primary care, to see what it's all about, to try it for yourself without any of the upfront costs associated with it. You can cancel at any time if you don't like it. You can sign up online, starlighthealth.com. You can email me, info@starlighthealth.com, or you can text or call that phone number, 970-632-0135. Please put your name and email in the chat, and I will be happy to add you to our newsletter and explain everything. And that's the end of my presentation.
Wonderful. Jason, we do have a couple questions.
Sure.
Okay, so let me start with RJ. Let me get back to her first question. Maybe you already answered this. With the monthly payment for your services, do I need to pay any additional, like a copay style, every time you come over? Okay, so I think you answered. It's just one-time monthly payment, right?
I will clarify it. So the monthly membership fee will cover all telemedicine visits. It'll cover all house calls as long as you are within like a 15-minute radius of me. If I have to travel really far, I will charge a couple extra dollars just for the travel. And then I will charge the near cost, so like the supply cost of any procedures that I offer. And those are all readily available.
Okay.
I'll explain those before I do a procedure.
Very good. What about pregnancies? Can you handle pregnant women?
So I'm not a gynecologist, I'm a family practice. So I can see a patient while they're pregnant, but I'm not going to deal with the pregnancy itself. So if you got sick or something while you were pregnant, that's not an issue, but an issue with the baby needs to be seen with the obstetrician.
Okay. And by being a PA, does that limit any type of service that you can do?
So kind of when it comes to really, really complex procedures, and you know, if there was a really complicated case like medically, I would refer you to my medical director or to someone who has a little bit higher training. For the most part, the patients out of all of my time, so out of 4 years of practice, I've only had to refer maybe 4 or 5 patients out because they were above my scope of practice. So it does happen, and it's an honest discussion when or if someone becomes a little too complicated. But this is why I have a medical director. This is why I have an MD backing me up to answer any questions, to give me advice, and we have access to specialists as well to answer any questions.
Okay,
so.
Very good. Okay, so a couple questions about keeping catastrophic insurance. By keeping the catastrophic, do you save money because you have to pay that premium as well?
Yeah.
Go ahead. I'm sorry.
So this model plays really well within the deductible of a catastrophic insurance, and I'm not a replacement for insurance. So if you were to get hospitalized, you had a car accident, a major illness, and you got a $100,000 bill from the hospital, I can't help you with that. This is a family medicine practice, and we are limited to the family medicine itself. So I do not advise someone to give up a insurance plan just to join my practice instead. But what I would recommend is if you have a really high tier, high expensive plan, downgrade it to a catastrophic plan and then add my membership on top of it. And that's usually how patients can save a lot of money.
Okay, perfect. Do you allow your clients to request any lab work desired, even things non-traditional that most doctors will not run unless they decide it's warranted?
Can you clarify that? I mean, it's
Maddie, do you want to unmute yourself so you can tell Jason exactly what type of labs you're talking about?
Yeah, sure. Hi, Jason. Yeah, I was just curious. I'm a nutritionist and I have lots of clients who, I'll try to send them to their doctor to get things covered via insurance. Even things like all 7 markers of a thyroid panel. Most doctors will only run 2, maybe 3. And so I just wasn't sure if you'd allow, I have some clients too that have a similar relationship with doctors where they can go in and say, hey, I want to test my omega to my omega 3 to 6 and things that are really specific and important for my practice. But a lot of traditional doctors don't find it ever important, and oftentimes insurance won't cover that.
Yeah, so I mean, this whole system is outside of the insurance model, and at the end of the day, it's a conversation. If it's something that we can mutually agree is useful and helpful, and if it's going to even so much as give the patient peace of mind, I mean, I can support that. At the end of the day, it's out of your pocket, and a lot of the big issues with the traditional system is that we are limited by the insurance, and we are how we treat patients is dictated by what they will pay for. And if they don't pay for it, then it's a lost service. But if you are willing to pay for it and it doesn't matter to you about the out-of-pocket cost, then it's just a conversation. And if we can agree that it makes sense to test for something, then I'm on board. So.
Very good.
Awesome, thanks.
Jason, another question. How is your competition in Northern Colorado?
Yeah, there are several, and one of them is on the call with us. So I'd say there's about 4 or 5 in Fort Collins area. And the beauty of direct primary care is that because we are outside the system, is that we can individualize our practice. We can create our own system and our own models. So no direct primary care is alike. If you like one, you may not like the others, or vice versa, you may like all of us. My particular system is a little bit different because I'm mobile and I go to patients' houses, and that's like my exclusive thing. I don't know that any of the other ones do that. And, I'm going to try and keep my practice a little bit smaller than those. So hopefully I can spend more time with patients.
Very good. Kimberly would like to, how much do you charge for an ultrasound, CT scans, or any other tests like that? Or how is that charged?
Great question. There we go. So we use Health Images for that. We use their self-pay pricing. It's listed right here. An MRI is $450 without contrast. CT scan is $325. Ultrasound is about $200 for that. I am currently working on getting a point of care ultrasound that I would be able to provide with the membership. That's not ready. That should be good in a couple of months, or we'll kind of see how long that takes to get ready. But that will be eventually included in the membership.
Okay. Let's see. Are you able to admit patients to the local hospitals if needed?
No.
No.
That's one of the downsides of being a PA. I don't have privileges for that. So I guess I could talk to if that. I don't think that's something I want to get into, honestly.
So would you refer them to an MD at that point? Is that when you would bring in your medical doctor and they would do that if they needed to go to the hospital? Or?
If you needed to be admitted, you'd probably be going through the emergency room, and the hospitalist would see you and they'd kind of do their thing.
Okay.
And then I would see you when you get discharged, and I could take over from there.
Okay.
But no, there's no need to refer you. And it's just, if you required to be admitted inpatient, then that would be the time to see them, and I'll see you when you're back to normal.
Okay. How do you handle people with Parkinson's or Alzheimer's?
Carefully. Honestly, I haven't seen that very often. And the first thing I would do is get a consultation with a neurologist and get their recommendations. And we'll try to handle it and do what we can in person. If I need to, I'll get a neurologist involved more personally. It's, I am a generalist. I'm not a specialist. So sometimes these things go a little bit over what I'm capable of, but it's, we start from the ground up, and if it's working, we don't need to get anyone else involved.
Perfect. Are you associated with any groups, any DPC groups, anything like that? Any affiliations?
No.
No, okay. So Nate has a question about safety procedures now. Can you talk about the safety procedures you do now in time of COVID for house visits?
Yeah, so everything gets wiped down and clean. I wear a mask for sure. Doesn't matter if you don't, I'm wearing a mask no matter where I go. And all the equipment and supplies that I use that actually goes into the house, so my bag gets sprayed down. I have special transport containers that are, marked biohazards and things like that. When I get back here, everything is cleaned and autoclaved and sterilized. So, for the most part with COVID, it's, number one, I'm going to be asking you, hey, do you have a fever or cough or anything like that? And if you do, I'm probably not going to go inside your house. I'm probably going to have you step outside on the balcony, or meet you at a park, or maybe in a car visit, and I'd come in and I'd give you a little COVID swab, and kind of protect myself. And by doing that, I can protect other patients. So
Okay. Cool.
I don't want to get COVID, and I don't want to give anybody else COVID.
Very good. What do you offer in terms of mental health care?
Number one, you got 60 to 90 minutes to just talk with me. And, we can do medications if we needed to. I can refer you to a counselor if you need that. It's, pretty much what you would typically do with a family practice. It's, you just get more time to actually talk. And sometimes that's enough for people.
Okay. And 2 more questions. You got a lot of questions, Jason. How many people do you have on staff?
1, just me.
Okay,
So I have a medical director, I have a lawyer, and the medical director is available at any time to answer questions, but he's not really on staff. For now, since this practice just opened, I don't require any staff. I anticipate once I get like 100 patients or so, I should be getting a medical assistant, but it's not necessary yet.
Okay. And is there a yearly contract, monthly contract? How does that work?
There is no contract. It's month to month. You can cancel at any time. There is no cancellation fee. What I will charge you for is if you cancel and come back. So this is intended to be a long-term relationship, not a come in, get your care and leave type of thing. So I don't charge you if you cancel. If you don't like it, you're not happy with your care, that's fine. Just don't be coming back and forth, because I will charge for that.
Okay. And any special meaning behind the name of your practice, Starlight Health?
Kinda. Like I said before, I was starting out as aerospace engineering. So living in Orlando, I live right next to the Space Coast, and my original plan was actually to work at NASA. So I was actually planning to be an astronaut for most of my life. So kinda, yeah, there is a little bit of meaning behind it.
Very cool. And then can you repeat the special offer today? Some people are having a hard time reading the words because it's too small.
Oh, really? Oh, man. So if you choose to schedule a consultation appointment with me within the next 3 weeks, so that's an expiration date of August 28th, you will receive 3 months of free membership fees for you and your family. Among that, if you are one of the first 3 patients to sign up, you will receive an additional 3 months of free membership. So that's 6 months if you were the first 3, one of the first 3 patients, and that's 3 months if you sign up within the next 3 weeks. If you missed that deadline, you missed it.
Perfect. Okay, guys, any other questions? Jason, will you unshare your screen so I can see all the little boxes?
Absolutely.
Wonderful. There we go. Okay, any other questions for Jason? You can wave your hand too if you want to just wave your hand, so chatting it out, typing it out. All right, I'm not seeing any other questions. All right, well, let's give Jason a big round of applause and thank him for being here today. We really appreciate it, Jason. And I think we have 2 minutes. 2 minutes.